9 months, I have seen involved with treating patients with COVID-19 and seen the impacts on my community as well as the healthcare setting. I've really seen how this disease has impacted individuals, family members, as well as communities. When the COVID vaccine was starting to come out and we knew that we were going to be getting some at some point fairly soon, I had a lot of questions to myself, especially with the Operation Warp Speed, which to me just made me a little bit nervous, thinking that something was getting pushed out really quickly, maybe before adequate screening or safety processes were in place. And so I took the opportunity to try to educate myself, looked at a lot of the data, looked at the safety profiles and the effectiveness of the vaccines. After doing that research, I've realized that these vaccines have actually been under production for many years. There are a lot of people working on these, more than any other vaccine in history. I was much more reassured about the safety profile that we have and the effectiveness data that is out there. These kind of vaccines have been worked on for many years, since the initial SARS and MERS outbreak many years ago. And frankly, at this point in time, we don't have great treatment options for COVID-19. And so being able to get a vaccine that can be 95% effective at reducing symptomatic disease can really make a difference on the burden of the disease, the long-term potential outcomes, and death. And so anything that I can do to try to minimize that risk, both for me, my family, and my community, I made the decision was worthwhile for me to do. And so I did choose to get the vaccine, and I'm looking forward to getting my second one in a couple weeks.